Okay, hey everybody, can you all hear me? Great. My name is Bonnie Brzozowski. I'm a reference librarian here at the Corvallis Benton County Public Library. Welcome. If you don't know me, it's nice to meet you. I'd like to welcome you to today's random review. Along with my coworker, Mike Hansen, and we are the co-chairs of the Random Review Committee. That committee is a group of 9 folks. We come together once a year to select books and reviewers for this 10-month series. We actually have our meeting to decide the next season in May, so really exciting. Thank you to the committee and to the Friends of the Library for making Random Review possible, and a special thanks to Gary Whitehouse for writing our fabulous press releases. If you're not familiar, I want to mention our Random Review webpage. On that page, you can find the Random Review schedule of events, a list of books related to each book reviewed that is compiled by our volunteer, Gail Gerdeman. And it will also link to audio recordings of each of these events. So if you miss one, you can go back and listen later. Our Random Review webpage, there's a direct link to it from our homepage. There's a big button that says Random Review. So click there to get there. I also want to take a second to thank our Friends of the Library group for their co-sponsorship and their support of Random Review. If you don't know, they not only founded and ran the Random Review series for 30 years, they also coordinate and run book sales whose funds benefit the library and support the library in many other ways. So you can learn about them or how to join them, how to volunteer for them at their website, friendsofthecbclibrary.org. But speaking of book sales, just so you know, the Friends of the Library is having one of their big book sales Friday, April 19th, through Sunday, April 21st in the Solar Building at the Benton County Event Center and Fairgrounds. The Friends are looking for volunteers to help out at the book sale. So if you'd like to volunteer, I have some flyers in the back. You can take a flyer or you can just scan the QR code and volunteer. We'd really appreciate it. Okay, enough listening to me. Let's get to our main event. Today, we've invited Dr. Helen Cow, Medical Director of Clinical Innovations at Lumina Hospice and Palliative Care, to review The Invisible Kingdom, Reimagining Chronic Illness by Megan O'Rourke. I'm especially excited about this one. This is a book I gifted to many people last year because I connected with it so much. But before we have Helen start talking to us, I'm going to invite David Grube up. David Grube is a member of our Random Review Committee. You may recognize him from other random reviews. He's done many for us. He's going to tell us a little bit more about Dr. Cow and how they met.
Thank you so much. I'm so excited about this because when we picked this book last May, I thought, well, there's one person that should review it because she had reviewed Remember by Lisa Genoa for us a few years ago, and that's Dr. Gowan. So thank you for coming today. One other thing I wanted to say before we begin, I know you probably know who's sitting next to you, but if you don't, you're going to learn. I want you to all turn to each other and look at them and say, did you turn off your cell phone? Conversation starter. So it's such a small world. 9 years ago, when we were reviewing Being Mortal by Atul Gawande, that was the day that I met Dr. Gao. She was here visiting, and she was in the faculty at University of California, San Francisco. And she was sitting right back there, or standing right back there. And when the presentation was done, she not only had a really very poignant and significant question, but she also had a quite poignant and significant statement. And so afterwards, I had to meet her and find out who is this person. And I learned that she wasn't living here yet, but was thinking about moving here. So after my sage counsel, she did move here a couple years later, and we are so blessed to have her in our community as the palliative care director at Lumina Hospice. And I've worked with Dr. Gao in many different arenas, and she's a fantastic physician and person. So there's a lot of things I could say about her, on and on. So I'm not going to tell you that she went to Harvard, or that she got a degree in English literature and Eastern Asian literature, or that she had all kinds of awards, including 2 years ago on this very day, I think, the National Clinician of the Year for the American Geriatric Society. Pretty incredible, really. Yeah. No, what I want to tell you are a few things. She loves to sing. That she sent me this quote when I asked for a little bit of a bio about her. She sent me this quote. She said she loves, and quote, being able to raise my two kids as well as a four-legged furry one in this incredible community surrounded by woods and creeks and mountains. In addition to being a huge fan of the library and the impressive music and arts here, I'm constantly touched by the level of volunteerism and service among the neighbors who live here. This place just feels like warmth. Dr. Gao.
Wow, okay. Can you hear me all right?
Yeah.
So I don't have any slides, and I have to say that this book was challenging. For those who've read it, it's dense. And as I was preparing for this, I'm thinking to myself, this is like writing a college paper, and I haven't done that in over 20 years. So I'm gonna try to give you my thoughts on this book, as well as my sort of personal perspective coming from the medical field and working with many people who have had chronic or serious illness. So I'd like to start by just saying what's really unique in the, is it?
Is that on there? Yeah, it looks like just hit the push button.
I just want to make sure we get it for the
Which one?
wording.
Perfect. There you go.
Okay.
You're good. Thank you so much. Sorry to interrupt.
Okay, is that better?
Oh, it's different.
Okay, it's not just me yelling. So I think what's really special about this book and interesting to read is that it is a fully integrated literary work where you've got Megan O'Rourke giving her personal narrative, basically a journal, her illness story. There's a whole field called medical humanities, which is about sort of the writing and the arts related to healthcare. And so she's giving her personal story, what we call illness narrative or illness story. And then it's all interspersed with very journalistic, scientific information about the history of our microbiome, the history of autoimmunity, the history of various significant medical illnesses, many of which she was looking to for answers or seeing whether or not those fit her diagnoses and her symptoms. And also a little bit about sort of our predominantly American healthcare system and the flaws in the American healthcare system. And so you kind of go back and forth weaving through that. And at times, you know, her story in terms of the narrative that she's giving, it can get a little bit repetitive because she has illness and symptoms. She has a little bit of rise and feels better. And then you're back down feeling low with her because the symptoms come back. They're profound and debilitating, and then she has a little climb up. And that's what she wants you to feel, because that was her life experience for over a decade, where she just felt ill, and no one was able to diagnose her what she was experiencing. And then she would explore these different pathways of interventions to try to, in large part, treat herself, because the doctors and providers that she was seeing couldn't always find the answers for her and didn't know how to treat her. And so she would try and experiment different things. As she put it, she was her own guinea pig as she tried different treatments. And sometimes they worked. Sometimes she would get a surge of energy, a reduction in her symptoms, and then another crash. She got a cold or some stressor that sort of flared all of her symptoms up again. And so that's the experience that you get reading this book. It's like you're rooting for her, and then it's like crash. Everything is going great, crash. And that is the experience that she's trying to convey within her book, The Invisible Kingdom, which is very much kind of a story of how do you come to live with illness or illnesses that are not curable, for which you don't have a solution. And in some cases, for many, many, many years, you don't even have a distinct answer for. So I'm going to start by actually in the very first page, first 2 pages of her book, she introduces her story, her illness narrative, by saying how she doesn't even know when it began. So she describes the start of it could have been in 1997. She'd graduated from college, and she began having weird recurrent rashes and hives. Occasionally they would be accompanied by dizziness. Sometimes she would have just kind of unqualifiable pain in different parts of her body, and sometimes drenching sweats. And she didn't know what it was for. She didn't even think at that time that they were related to any kind of illness. She just thought, okay, well, this is sort of weird. And then it would pass. And then go forward another about 9-10 years. Her mother died on Christmas Day in 2008. It was devastating for her because of her relationship with her mother. And she described that after her mother's death, she caught a virus and she just had debilitating fatigue. It was accompanied by aching lymph nodes that lasted for months, not just days and weeks, and a profound brain fog that at the time she just attributed to having grief over her mother's death. And you'll see this repeated theme of trying to make sense of what she's experiencing, and that very complicated overlay between our mental health state and our physical state, which she talks about a lot in her book. A month after her mother died, she was diagnosed with mono, which is mononucleosis, which is often attributed to, not often, but attributed to Epstein-Barr virus. And she was told that she had mono, but then her symptoms never really quite got better. And then now, 4 years later, January 2012, she is relaxing on a beach, reading a book with her partner, and she notices a weird rash on her body, a very kind of unusual rash. It was round, it was raised, it was arranged in the pattern of a circle. And she just said to her partner, "Oh, isn't this strange?" Over the years, all of the confluence of all of these different symptoms, rashes, brain fog, joint pain, dizziness, would all come together in repeated ways that really debilitated her life. She was a journalist who had done very well for herself, and as well as a writer. And part of her way of trying to make reason out of all of this experience with illness and searching for help was to create this book, in some ways to make meaning for herself, as well as to help other people who are experiencing similar types of experiences. So what she wrote was, without answers, at my most desperate, I came to feel in some unarticulated way that if I could just tell the right story about what was happening, I could make myself better. So I'm gonna preface that in her book, she uses the term chronic illness, and many people have heard that term chronic illness, chronic condition, and they often think about things like hypertension, diabetes, high cholesterol. Those are the common, typical chronic illnesses that most healthcare providers and people in the community think about. When she refers to chronic illness, she is very much describing what are sort of ambiguous, not clearly defined diagnoses, immune-mediated illnesses, which I'll talk about in a bit in terms of autoimmune illnesses, and the experience of just having a poorly understood illness. And so chronic illness is a little bit different from kind of what you may have heard before. So I'm going to describe in a very summarized way her search for care and her search for some definition to her, to the many symptoms that she was having. Before I describe what her journey was through the course of this book, I want to describe certainly how I learned. I don't know if David learned this way too in his medical training. And of course, I'm speaking from the allopathic Western MD perspective, because that's the training I know. Most physicians in training will at some point in their careers learn about something called Occam's razor. This is actually a philosophical principle, but basically what it means, and you can think of a razor, is you have numerous possibilities, and in medicine we call it the differential diagnosis. You can kind of show how smart you are by kind of listing off the possible differential diagnoses, the different diagnoses that could be contributing and leading to a person's symptoms. And what Occam's razor means is that in our training, we are meant to be detectives to identify all the symptoms a person has, their story, their timeline, what makes it better, what makes it worse, And then we try to weed out the stuff that, that we can, rule out with testing or because their symptoms don't match the pattern. And then we winnow it down until we get to Occam's razor, which is the diagnosis that best fits the constellation of symptoms. Now, we all know now that that doesn't always work. O'Rourke's example is perfect in the sense that while many of us have been taught in the medical profession, you're trying to find kind of the one main defining reason for a person's symptoms. But as we know, for instance, the majority of Americans have more than one chronic illness. And similarly, in her case, she ultimately had more than one diagnosis. And so, so this idea that you can take all of the symptoms a person has and try to clean it up into a clear diagnosis that then you can, okay, diagnosis A, add treatment B, and you've got result C. Well, that doesn't always work in many situations. And certainly in the case of, in her words, poorly defined illnesses, that is all the more true. So what she went through is, so the number of medical specialists she saw, and many of you maybe know someone or yourself have had this experience, because of these sort of ambiguous and vague symptoms, fatigue, dizziness, joint pains, brain fog, occasional sweats, occasional fevers. She saw rheumatologists, neurologists, endocrinologists, psychiatrists, infectious disease specialists. And when she had run through most of the standard sort of Western medicine specialists, she began seeking care through what in what she's termed alternative medicine, although there's many different definitions of that. So naturopathic physicians, functional medicine providers, integrative care providers, herbalists, etc. And initially, as she was going through her journey, she was first diagnosed with an autoimmune thyroiditis, which is actually quite common. So many individuals will develop antibodies that attack their own thyroid and develop a thyroid-mediated illness from that. And it's generally treatable, and most people end up, doing fine in their life. She was really hopeful that that diagnosis would be the answer. And okay, I got a diagnosis, and that's done. She took the medications as she was prescribed. Things didn't get all that much better. Her labs were, as she discussed with her endocrinologist, they were kind of equivalent, meaning that they thought it was treated. Her endocrinologist thought that maybe she needed to lower her dose. She felt like she needed higher dose because she was feeling heavy-legged and fatigued still. And so her endocrinologist says, go for it, which I think, as she writes about, kind of gives you, a wonderful snapshot into doctors don't always know what's going on, and they might have an idea of which way to go on medicines, and the person living with their body is feeling the other way. So through the course of her treatment, she tried multiple different therapies, which I'll outline in a bit. But ultimately, what she found in the course of her journey was that she was diagnosed with multiple different chronic illnesses. So she was not only diagnosed with, and I should say some of these, as she writes about, felt like appropriate diagnoses. Others she felt like were not appropriate, and I'll talk about that too. So mono, Epstein-Barr virus, heavy metal poisoning, multiple food allergies, complicated grief, stress, told many times, you work too hard, you just need to relax and it'll all get better. Ehlers-Danlos connective tissue disorder, POTS, postural orthostatic tachycardia syndrome, and then ultimately chronic Lyme disease. So the different treatments that she tried, aside from sort of conventional Western thyroid medication and antibiotics, she did try mental health counseling. She tried bereavement and grief counseling to try to address what was very profound grief about her mother's death. She also tried many alternative treatments. So this included everything from IV vitamin infusions to fecal transplant to blood hyperoxygenation, heavy metal chelation, extensive supplemental regimens, restrictive diets, meditation, and relaxation retreats. And what she describes over and over again is, and she is upfront in saying this, is that she has the privilege as a white cisgender woman who has decent financial resources to pursue all of those. Because as you can imagine, medical insurance does not cover heavy metal chelation and in some cases, fecal transplant is for some diagnoses, but most of what she pursued was entirely paid out of pocket. She also flew to different places to seek treatment, which is, again, something that she talks about as a huge privilege that she had. It's not everyone with chronic illness, especially when she talks about her position and her ability to pursue these treatments compared to someone who is Hispanic, who is poor, who does not have the socioeconomic resources, or even, the literary and verbal ability to confront their physicians and their providers in the same way that she was able to question things. So at the end of this long journey and getting multiple diagnoses, she talked about how she has found, improvement in her health. She's able to function, but her identity is now as a person who has these chronic illnesses and knows that there will never be the silver lining of a cure for what she's experiencing. And so the shift in her identity is going from trying to just search for some diagnoses to learning how to live with a chronic illness and chronic illnesses, as well as the ongoing uncertainty, as well as in some cases, sort of the medical societal conflict over whether or not her illnesses are real or not. So I'm going to just briefly, I don't want to spend too much time talking about her medical diagnosis because that's not the point of her book, but I'm just going to briefly explain her diagnoses because it helps to understand why she has the symptoms that she has, what she is pursuing in terms of her treatment course. So I'm just going to go over a few of the main ones. So Ehlers-Danlos is a connective tissue disorder. It's often a genetic disorder that leads people to have very frail, thin skin. Our connective tissue is, our joints, our tendons, our ligaments, the lining of our organs and our vasculature. And so, in mild cases, people have very easily bruised skin or skin that doesn't heal well. In very severe cases, you may have people who have severe connective tissue disorder that they have rupture of their vasculature and rupture of their organs like their uterus with pregnancy. POTS, which is a postural orthostatic tachycardia syndrome, is actually not an uncommon syndrome. There are many people who have this condition, but for her, it was not diagnosed until years after she had already been having a lot of these symptoms. So what it generally is, our bodies are able to regulate. So if I'm lying down and I sit up and then I stand up, I don't automatically pass out, even though I've gone from a reclined position to standing up. Our hearts and our vasculature go through this intricate neural pathway where everything squeezes so that the blood pressure you had when you were lying down can be maintained when you stand up, because otherwise all your blood would just sink to your feet, and which it does in POTS, and you get very dizzy, you get lightheaded, you can suffer from brain fog, dizziness, etc. So there are different various treatments for POTS, but it helps to explain a lot of the symptoms that she was having in terms of repeated lightheadedness and dizziness and sometimes passing out. And then untreated Lyme disease or chronic Lyme or post-treatment Lyme disease. So I am not going to go in depth into this because it is still a field that is full of lots of controversy. There's sort of two different directions that an individual can experience a Lyme disorder. So one is they had the infection, they were never treated, and they have chronic Lyme symptoms because their illness was never treated. And then what is called post-treatment Lyme disease syndrome is where you knew you had Lyme disease, you tested, you were given antibiotics, the appropriate antibiotics, but you went on, whether weeks later, months later, to have ongoing or recurrent symptoms. And this has been recognized by the Centers for Disease Control. The Infectious Disease Society of America has recognized post-treatment Lyme disease. And I think the wonderful parallel that O'Rourke gives is that for so many years, people have had this ambivalence about, is there chronic Lyme disease? Is there post-treatment Lyme disease? And here we go, boom, COVID pandemic. 3 years of intense lockdown and isolation and people getting sick, sometimes with relatively mild COVID, but then who went on to have very profound longitudinal illness, despite the fact that, they no longer actually had any identifiable COVID infection, and whether or not they took a COVID treatment or not. So the era of this post-COVID world has, I think, really pushed forward this look into what is autoimmune disease, what are chronic symptoms that people can have from something like an infection. And so there's a lot more acceptance of that. But in regard to untreated or chronic Lyme disease, a lot of the symptoms that she's had, a lot of the symptoms that people with long COVID are experiencing are similar. So as she describes often, brain fog, roving pain, difficulty with their joints, dizziness, profound fatigue, and inability to concentrate and to work, sometimes depression related to those. And the challenge with Lyme disease is that the diagnostic testing that is available for Lyme disease makes it hard to, you can't really identify Lyme disease right exactly in the moment and right away, in the same way that some of you who have perhaps had symptoms and then later tested positive for COVID, it sometimes takes what we call a little incubation period for a test to turn positive, because the available tests that we have for certain illnesses, they're not perfect, and or they are looking for things such as antibodies, which don't show up until later in the course of your illness. And so that is part of why there's a lot of controversy. It's sometimes hard to really pinpoint and identify, who are those patients who have Lyme disease, and what do you do about, a lot of new research. Actually, it's not even that new, which is showing that, for instance, in mice models, the bacteria that causes Lyme disease can exist in mice for months after they have had an appropriate antibiotic course for that bacteria. So those are kind of the main medical illnesses that she's had. She does not reject the idea that grief was part of her overall experience. So she does talk about her grief. She does talk about how being in the absolute depths of trying to figure out her diagnoses, that she would go into deep depressions, into very dark places, describing, not wanting to live or feeling like she was at the end of her life. Now, the one place I will say that that for me was uncomfortable reading her book is that, when she talked about being dismissed over and over again by different healthcare providers, she would describe, going to see this provider and that provider, and as many people who have sort of poorly defined symptoms will experience, is they're told, just go relax, or don't work so hard, it's anxiety or it's depression. So I very much agree with her that that it's a failure of our healthcare system when someone is dismissed and further diagnoses and evaluation and support for that person aren't offered. At the same time, where I felt uncomfortable is that, depression and anxiety are real illnesses. And so for me, there was a bit of feeling like she was saying, like, I'm not that, which is just creating more kind of us versus them from my view. Though I understand why she was saying in the context of her book and trying to find the solution for her diagnoses. So with that kind of description of her journey, I am going to try to break down now the main themes that I think she brings up in her book with half the time I have left. So I'm going to start with kind of the more medical piece, which is sort of medical environmental piece, which is she weaves through her book a lot of focus on her nutrition, trying this diet, that diet, trying to pare down what she's eating to identify what could be causing her symptoms. And she is able to identify some of it was done through allergy testing. But what I think she does a wonderful job of describing in her book in really understandable terms is this really emerging concept of microbiome. Now, for decades, healthcare, especially in the 1940s, 1950s, as antibiotics were emerging and the wonder of antibiotics, you have someone who gets sick with an infection, boom, you give them an antibiotic and they survive. So it's remarkable. And I'm not going to poo-poo antibiotics because by all means, we need antibiotics. We use them every day. But I think what she describes in a wonderful way is that, we now know that antibiotics or bacteria or viruses, really, microorganisms are not always pathogenic. Our bodies are filled with stuff. So we are like walking hosts to lots of bugs. And many of the bugs that we think of as dangerous and pathogenic, in reality, many people in the world walk around every day with some of these bugs and don't ever get sick, or maybe don't get sick for years. So to give an example, one that she uses in her book, it's H. pylori. So H. pylori is the bug that has been identified as the most common cause of gastric ulcers. And there's this wonderful description of the scientist who discovered it by self-inoculating himself, basically drinking a whole bunch of H. pylori. I can't imagine doing that. I hope he was paid really well. And it made him sick. They did an endoscopy. They saw that he had inflammation. And then he actually recovered. And his body's immune system was able to clear it. Now, we know that H. pylori is the most common cause of gastric ulcers and also gastric cancer. But 75%, plus or minus of the world walks around with H. pylori in their body all the time. And it's easily transmissible, saliva, kissing, food, water, whatever. And so the question becomes, what is pathogenic and what is just kind of living around us all the time? Another example that I use and deal with every day is urinary colonization, because very frequently in older adults with dementia, I constantly get the question of, we need to check a UA because someone has a fluctuation in their mental status. And what the research has been coming to show, and what I try to educate people is, well, the reality is that everyone, and especially older adults and people, older women, are colonized. Everyone is colonized with bacteria, including E. coli. E. coli is what everyone thinks of as that is the urinary pathogen. It gives you, bloody urinary tract infections. You get really sick. You end up, in the ICU. It's also very treatable. But what we now know is that people can live in a perfectly benign state with E. coli. So the science about the microbiome is constantly changing. There's so much research happening to try to identify, when does a microorganism go from just a peaceful harmony with our body to some switch happening and it becomes pathogenic. And also, what are the factors in our body that suddenly cause our immune system to say all of a sudden, oh, this bacteria that was, I didn't mind it before, I really mind it now, and it creates an immune response. So that's all the research that is happening. But what the reason why she talks about the microbiome is because what she describes is where our modern society has evolved over time. Our bodies live in a constant state of homeostasis, harmony between our microbiome, our healthy bacteria, pathogenic bacteria, our environment. And there is a lot of growing evidence that when we are hyper clean, and this is the COVID era, right? We're all hand sanitizing me every day, every 5 minutes. That we might actually be doing some harm to our environment and to our bodies. So for instance, babies who are born by C-section instead of through the vaginal canal and are not exposed to like the whole volume of a woman's, vaginal peri area bacteria, tend to have a higher rate of things like asthma and allergies. And the same goes for, if you look at, sort of modern countries versus countries that don't have the same, access to water, to bathrooms, et cetera, healthcare, there is a very different level in the population of different autoimmune diseases, which I think is being attributed to sort of the differences in how our bodies are exposed to normal, everyday bacteria and microorganisms all around us. She describes also the change in our diets, increasingly processed food. We are not having stuff straight out of the dirt, so we're missing the natural soil-based bacteria that normally we have eaten for centuries in our generational lifespans. And all of those things we think of it as, oh, it's clean, it's better, but the reality is that maybe it's not better. And the increasing use of antibiotics in livestock, the increasing use of antibiotics in people in general, which is why I harp on the UTIs a lot, because a lot of overuse of antibiotics, the result is antibiotic resistance. And every time you take an antibiotic, antibiotics are not specific. If I take an antibiotic for an E. coli UTI, it is not just going to go for my E. coli, in my urine. It's going to go for everything else that's susceptible to it. So every time we take an antibiotic, it's like this massive, like you're just completely changing your microbiome. And that's why we could recommend probiotics. And but the reality is that we live, and this is her kingdom, and this is part of the kingdom. There's different ways to describe the kingdom in her book, but this is part of the kingdom that we live in. We are in constant relationship with every other person, our environment, the food we eat, the things we touch and do, the activities we choose. And so alterations in that, even for the good, taking an antibiotic for Lyme disease or taking an antiviral for COVID, they are things that have repercussions. And so what we don't know yet is what are the harms, and we may not know these for another 2, 3, 5 decades of our current healthcare, lifestyle, societal structure. So that's a little bit on the microbiome. The other thing that she does a wonderful job of explaining, because it's what she experiences in terms of her diagnoses, is autoimmunity. And to put it in very kind of short, brief synopsis, because it could go very long, is that we all have antibiotics. I just talked about them, in talking about microbiome and infection. But our antibiotics are what allow us to protect ourselves against some apparent harm. And that could be a bacteria, it could be a virus. Sometimes when allergies go out of whack, it is because our immune system is sort of seeing cat dander and pollen as something threatening. And so then our eyes are tearing, and I had this last week, I could not breathe, my nose was stuffy, I had a sore throat, scratchy eyes because of just the intense pollen and allergies last week. But what can happen when things get a little bit disordered is that the antibiotics that our body creates, which are meant to attack harmful things, not good things, or what we consider self, is that it begins to attack self. And this is part of her, how she describes identity, and in her book, this is one big piece of it, which is, what is your identity when your own body is attacking, or your own immune system is attacking your own body, and you're trying to figure out like who or what's the good and who and what's the bad, and having to consider taking potentially very strong medications to basically like quiet yourself and quiet your body's reaction to something that is not pathogenic, but that is causing harm to yourself. So, and how the autoimmunity is related to our microbiome is that sometimes things that get triggered with our immune system through an infection, in many hypotheses, is that it then sort of revs up the immune system, and our immune system begins to attack self pieces, whether that is, our joints, our thyroid, other things, our nervous system. So that's the sort of medical and societal big picture scenario that she describes. And then, in the context of the other way that I see her using kingdom is that there is a whole population of people who are struggling with these types of undefined, poorly defined illnesses. And they are invisible in the sense that they're being dismissed, they are not being taken seriously, they are not finding the solutions that they want from their healthcare providers. And so it's trying to assert that, there are many, many, many people who are experiencing this. And so there's also this kingdom of people. So it's not just one isolated person. She's trying to take, open up this sense of isolation and loneliness and open up to say that there are many of us here and we're asking for help and to be seen and to be witnessed. And that for her, in her journey, sometimes the biggest impact that she had from seeing a provider was when that provider actually paid attention and heard her concerns very openly and honestly and didn't dismiss her. So that brings me to this idea of invisibleness and loneliness. So with invisibleness, I've already talked about how O'Rourke emphasizes the dismissal she felt and that when you don't have an illness that can be diagnosed, and in her case, she was again, she acknowledges she was a white, middle upper class woman, that people sort of just assume, oh, you're not that sick, you look fine, and yet she felt extremely debilitated and very fatigued and could not do her function. And so that, how that threatens a person's identity, not only to be sick and feel like you can't do what you want to do, but then to have everyone dismissing you, or as she described it, that there is no lonelier place than to be told that it's all in your head, or that it is, that all your labs are normal. So, either you're not sick or I don't know what's going on. What she wrote in her book, which I can see, although I disagree with it, is she said, and this is the part where it's a mix of journalism and the science, how she asked a friend physician of hers, and her friend physician said that he was taught in medical school never to say, I don't know. And I don't know about you, David, but I have never been taught to say, I don't know. And in fact, I think many providers say, I don't know all the time. I say it quite regularly. And I think, though, her point is, when people don't know, it should be, I don't know, but how can I help you? Or what can I do to help you? Or I believe you. And what she was getting was, I don't know, bye. Was the experience that she had. So now, as I think about why did David Grube pick me for this book, I think about, my background is geriatrics and palliative care. So I think about the geriatrics and palliative care lens a lot. And for O'Rourke, what I see that was missing through so much of her search for help was the lack of witnessing and the lack of hearing. And that is what very much geriatrics and palliative care providers are taught to do, is to just be able to sit with someone, even if you don't have a fix or cure. And part of why I picked geriatrics is because I know that really the majority of healthcare problems in the world, we can't fix. Most of them are chronic illnesses. Most of them are things that we are trying to help people in geriatrics learn to live with. To help their families learn to live with, recognizing and just being realistic that, there are limitations to modern medicine. And so, yes, there are many things that the answer should be, I don't know. But I think what would have helped her within what she was experiencing with providers who were able to say, I don't know, but I believe you that you're not feeling well, and what can we do to help that? So that takes me to her sort of the what she describes as sort of this separation between what's Western medicine and what is alternative medicine. Why she sought out alternative medicine and why many people seek out alternative medicine, and again, I'm using that term broadly to mean all of the other types of disciplines and fields of care that aren't, MD, DO, is because in her mind, they were higher touch, higher care, whole body, whole system view. Which I can see that perspective. At the same time, again, as a geriatrician, I am all about whole body, whole system, whole person care. So I do recognize that our modern Western healthcare system is quite flawed. And I say that very openly and with much interest in how we can reform it. But the reality is the Western healthcare system is broken down. She describes it as silos into this specialist, that specialist, and this specialist. They have their niche for what they are trained to do, and we need them. We need them for their expertise. But there is not a lot of crosstalk across disciplines. And when you are someone like O'Rourke, who's experiencing multiple different vague symptoms, when you're told by the cardiologist, it's not cardiac, and then you're told by the nephrologist or the neurologist, well, it's not neurologic, or yes, there's probably some maybe small fiber neurologic stuff, but I can't pin a diagnosis on it. And then you're sort of just trying to find one specialist after another without anyone having the big picture for how to help you. And that's where, the geriatrics and palliative care lens, I think, can lend itself to healthcare, which is to help people see that big picture and see how do you help people still function and have a quality of life within their goals for what they want. Now, I do think there was a little bit of a sort of over description of the alternative medicine side, because she talks about how, Western medicine is, they check lab tests and x-rays, and if the result is not in, those x-rays and lab tests, then you're considered, well, you're not sick. And it's all lab-based and nobody touches you, and which is probably true. I know many people who I've seen over the years here who tell me that they haven't been physically examined in like a really long time. But anyway, that's another story. But it's not. It is not the case. I mean, if you look at many of the things that she was pursuing with alternative medicine, many of the things that she were pursuing were also equally numerous or more lab tests. This metal, that metal. Looking for this virus, that virus. So it's not that Western medicine is all about labs and X-rays, because frankly, a lot of the things she pursued was lots of lab tests, allergy testing with her alternative providers. But the experience that she had with alternative medicine was felt to her more caring, more holistic, and more high touch. What I call the laying hands on, which is, I think, really important as a healthcare provider. Now, what does that tell us about what is wrong in our experience with healthcare? So O'Rourke describes what she calls solutions at the end of her book. And she talks about the need to invest in autoimmune and chronic Lyme disease infection. And those are all very true. And the fact that there is a little bit more interest since long COVID to invest research in these areas is wonderful. At the same time, for me, I would blow up what the solutions can be based on what she has identified in her book, which I think is really well spelled out. We have a healthcare system where if the only way that you can get high touch is to go pay hundreds of dollars to an alternative medicine provider, and that you can't get that with your regular Western providers, to me, that is something hugely wrong with our healthcare system. But the fact is that, what medical insurance pays for is often not what people need and want. And what our healthcare system is designed at, you can't expect your PCP to give you a high touch experience when they have 8 minutes or 10 minutes to see you, right? So it is in my mind, not really a fault of the doctors in the system. I bet there were many, many caring doctors who wanted to help her. But when they're told to go see the next patient and the next patient and the next patient, and the system doesn't support them to take that moment to be with O'Rourke and sit down and say, I don't know what the problem is, but how can I help you? That is where we end up with this huge inequitable treatment where someone like O'Rourke, who has the financial means to go seek out high-touch care and alternative medicine, is able to do so. And then someone who is living, with a Medicaid or poverty income can only rely on what they can get. And they are not able to pursue those things that might give them more healing and more comfort and a plan forward for how to live with a chronic illness and to achieve some quality of life. So the discrepancy in that, which she describes, very clearly about the hundreds of dollars that she was spending, not just on the healthcare providers and the treatments, but on, the dietary regimen that she was keeping up is, I think, really stark. And then the last thing that I'll talk about is in terms of sort of how we think about the types of illnesses she described in terms of POTS and autoimmunity and chronic illness is what I touched upon earlier with a microbiome, which is that we don't have enough research. We don't know enough about all of the things that we think are so wonderful in our modern society. And they are, I'm not gonna, having cars, having airplanes, having, my phone, which I'm tethered to all the time for work. But the reality is, like, we don't yet know the full scope of how these things, the chemicals, the food that we eat, the way that we raise food, the way that we process and serve food, how this is going to impact, and maybe not even our lives, because we are probably all realistically looking around the room, we will all pass within the next 30 to 50 years. And who knows what the next generations are going to experience in terms of autoimmune diseases, latent infections. I mean, we just don't know. So all of the miracles of antibiotics, all of the miracle of the treatments that we have, incredible medical advancements. And at the same time, we are just on the edge of realizing that there are consequences to the kinds of changes that we make in our bodies and in our environment. So, boy, it's already an hour, and I really did. I mean, there's so much more in this book. As I said, it's like a college paper, and it is so dense. It's fantastic, though. So I hope you'll read it. And I'll give some time for questions. Because yes.
Yeah, I was interested in the chapter near the end where she talks about the establishment of clinical autoimmune centers. And it was like, yeah, this is a place. She mentions one in Israel and then one in Pittsburgh, West Penn Hospital Autoimmune Association, and the Allegheny Health Network, AHN Autoimmunity Institute. And where, it's a bunch of professional, multiple doctors coming in, and a model would treat any autoimmune disease. It's not just like focused. It was, I guess, based on lupus originally, treatment for lupus, but the guy, Joseph Aaron, was interested in expanding that whole concept to all of these things that we don't know much about. And so that just sounds like that's perfect. I mean, it's like the Mayo Clinic of autoimmune diseases or something, but I just wanted to know what you know about that and how viable it might be, or, to happen.
Reading it in her book was the first I'd heard of it. So yes, I don't know too much about it, and if there are other centers cropping up. Again, I would imagine that with long COVID, because simply the breadth of the population that is experiencing long COVID compared to at least what people have thought about autoimmune diseases, that just sheer number will propel more research centers to focus on autoimmune disease. But I don't know enough, and I don't know what's funding it, if it's all, if it's coming from the federal government, NIH, or elsewhere. So,
Yeah.
And she does talk a lot, and I didn't go into that, but there's, she does a wonderful job describing how most research in our medical field, there's so much, part of why she has so much difficulty being diagnosed is there's a lack of research in these sort of nebulous autoimmune areas. But it's also, research that has been predominantly on men versus women, predominantly on younger people versus older people, predominantly on white people versus people of color.
Nice.
Yes, and male mice too. So, we have a long way to go in terms of improving our knowledge and how applicable, research on a man is to a woman.
Thank you.
Yes.
What's your take on microplastics and their current and probable effects upon everything?
Yeah. O'Rourke does not talk about microplastics. And I have a non-scientific, I am personally concerned about it because I do think that the preponderance of plastics, which we now know really, despite everyone saying they're recyclable, most of it is not. Most of it's ending up in our landfills and our oceans. Even separate from whether it impacts us humanly, which I do think it does, because you can identify them in our bodies, the impact on our environment and our diversity, I think is huge. And so, yes, I do have concern about that, how that will impact us. I don't know. I think it's quite possible, and we don't have a definitive research on it, that, having microplastics floating around in our body could well be the nidus for an autoimmune response. I have no idea. I'm just throwing that off the top of my head. But we know that antibodies are supposed to attack things that are foreign. And so certainly having chemicals in our body probably doesn't help. Mm-hmm.
This isn't a question, but just a comment. I have a friend who has a family member with this kind of condition. I gave her the book, and then she wrote back and said, well, I bought copies for all of my sisters who just can't understand what's happening here. And she felt that if people got through it, they at least got a little better understanding of how the lives these people lead.
Mm-hmm. Yeah, thank you. Mm-hmm.
Are there other countries that do it better than us?
Do it as in healthcare, or it as in environment, or? Well, I am personally a huge proponent for universal healthcare system. That's me. Because I think that, to give an example, my organization has to get contracts with insurers. There's one large national insurer that has over 40 different plans. I mean, you cannot make heads or tails of what's covered, what's not covered, and the amount of time that physicians and healthcare providers and their clinics spend on trying to do the right thing for a patient is sucked up by that, among other things. But so I also think that part of a universal health plan takes away, as well as there needs to be huge reform in how we reimburse providers. So part of what O'Rourke experiences, what she wants is the high touch experience, which we know that actually caring and empathy, whether or not you give a medicine or not, can heal people. And again, I'm not poo-pooing antibiotics and real medications, but we know that caring is healing. And so when the surgeon is reimbursed at 3 to 5 times what the cognitive provider, who's just talks to their patient, is paid, you end up with this differential where procedures are what are prioritized, interventions, x-rays, tests are prioritized, and not the time that someone actually spends with a person in need. I honestly don't see how this will ever change, how what she is experiencing in this book will ever change, regardless of whether autoimmune centers are funded and research increases, unless we have a change in our priorities with our healthcare system, how we reimburse people, how we recognize the healing aspects of care and not just the testing and the pharmacologic and the surgical. Yeah.
Yeah, I worked in healthcare for many years. I'm fortunately retired, but I was just gonna say my husband has long COVID, so we've been going down that path. And we like our primary care physician a lot but all he could offer was, make sure you're getting rest, eating healthy. I can't maybe drink, I don't know, drinking fluids and stuff. And that wasn't helping him. And so we did, decide to go an alternative route. And he's actually been, it's somewhat alternative, although there's some conventional.
Mhm.
And he's actually responded to that, which is really
Great.
so I don't know if, I guess kind of back to insurances just don't pay for alternative care. Some of them I know pay for naturopath,
Mhm.
some acupuncture and things like that. In terms of supplements and things like that, that also might be helping with some of these disease processes too. So we've had to pay out of pocket, which I feel fortunate we can do that. But so I don't know what he would have done if we had been able to do that.
Yeah, I think that there's, and it's again, it's where the money goes, where research goes. There is probably a lot of validity and truth to folk medicine, Chinese medicine, nutritional interventions, but we don't have necessarily the research. And so much of Western medicine, and I have to admit myself too, like I very much focus on what is evidence-based because I want to be sure I do right by someone. But the reality is we don't know everything. Like, I don't know if turmeric is really going to help someone's cancer. We don't have that data because the research and the funds don't flow to generate that research. And people are more interested and companies are more interested and certainly federal government is interested in things that are, going to be life-saving or, major research that can impact lives and disability. But yeah, it's unfortunately hard. So I think that there is this zone where people who are working in functional medicine and naturopaths and nutritionists are doing it based on what evidence and what literature that they have available, and whether or not that fits into and partners with the Western medicine that they're getting. Hopefully that at least there's still some communication across the two, but. Mhm.
When I was, maybe a teenager and babysitting, my mother used to always say about little kids, that they needed to eat a peck of dirt, in their growing up years. And she never used the term immune system, but I'm sure it was related to this idea of, just building a strong child involved letting them play in the dirt and eat stuff that fell on the floor.
Mhm.
And that definitely changed with the next 10 years or so until people were really being almost too clean in the way that they treated children, kept raising kids. But I wonder about in geriatric care, whether at the other end of life, you should start being super clean about how older people are fed and how their environment is treated.
What a great question. I would say that, yes, I do tend to and certainly there are certain professional standards that, caregivers, a healthcare professional that we have to keep, as caregivers have to wash between each client that they care for and between helping someone with any peri-care or toileting care. But an interesting question. I guess I would say that probably when we're talking about, someone in the last 5 years of life or so, there's probably less concern about creating lifelong, immune-mediated damage. And we are at that point truly trying to prevent, more immediate infective risks. So probably less so in the geriatric spectrum, but that's a great question. Yeah. Yes.
Now this may have come up because my hearing is not the best, but in the things I've read, I'm not a medical person, but as the population ages, proportionally fewer people are going into gerontology and age-related medicine. And that would certainly be, from my perspective, a big flaw in the system.
Well, I'll say that amongst my colleagues and myself, so geriatrics fellowships go unfilled every year because there are not enough people going into geriatrics. It is one of the fields where if you have an internal medicine or family medicine residency and then you pursue geriatrics, you make less money than if you hadn't pursued fellowship because Medicare tends to be a lower payer than private insurance. But I think from the field's perspective, the goal is to try to geriatricize all providers. Because really, unless you're a pathologist, a radiologist, or a lab physician, everyone is going to deal with and work with an older adult, even a pediatrician, because maybe the child is taken care of by their grandparents. So it's trying to figure out what the field is trying to do is how do we improve the in total knowledge and skills of all providers, because there will never be enough geriatricians. All right, thank you. I think it's time to wrap up, and I feel like I just rambled for a long time.